Now let's talk about the etiology. Again, there are various etiologies for autism spectrum disorder, which include genetic factors. We'll talk about some of the important genetic factors, some of the important genetic disorders which are associated with autism spectrum disorder. Neuroimaging, again, there are certain areas of the brain which are, again, proposed to be affected in autism spectrum disorder. Certain neuropathological factors, especially in the post-mortem studies, we'll talk about them. Then there is certain immune theories, immunological theories have also been proposed for autism spectrum. Then there are certain factors, related with the perinatal or the prenatal and the neonatal period, which may subsequently lead to autism spectrum disorder. And of course, we'll also talk about some of the psychosocial theories, some of the psychological theories which have been proposed for autism spectrum disorder. Let's talk about the first important factors, which are genetic factors. So again, from family studies, from twin studies, we have seen that genes play an important role in development of ASD. In fact, it is seen genes play a more important role than the environmental factors. So from the concordance rate, we can see that the concordance rate is more with monozygotic twins than with the dizygotic twins. And in fact, the concordance rate in monozygotic twins is 60% if we take a strict definition of autism criteria. And if we use a broader spectrum, then this rate further increases to 80 to 90%. So again, this suggests that yes, genes play an important role. It is seen that 15% of the cases of ASD, they are associated with a known genetic mutation. Again, an important data, especially for those who are, preparing for various entrance exams. It's important to know some of these data. So it is 15% of the cases, they have a known genetic mutation. And it is also seen that in siblings of children with the ASD, there is an increased risk of ASD. And in fact, in many families, this risk may go up to as high as 50%. And there is also increased risk of developmental impairments in communication and social skills. So again, genetic factors, seem to play an important role. Now, there are certain points which have emerged from various genetic studies, and some of those points include that these mutations basically, they are rare and often these are de novo. Often these are new mutations which occur and lead to ASD. And also in these, genetic studies, it has been shown that there is a high degree of genetic heterogeneity in the cases. And also they have been seen that there is a role of chromatin modification, synaptic proteins, and also it is seen that the fragile X MR protein, FMRP protein, also is associated with autism spectrum disorder. And an important point which has emerged from some of these studies is that the mid-fetal cortical development is an important period, and many of these mutations affect that mid-fetal cortical development, which subsequently leads to autism spectrum disorder. Now let's talk about this protein FMRP, which is shown to be associated with ASD. And in fact, many of the genes, which when studied, they've been shown that they affect this protein. So this is basically a RNA binding protein which interacts with many transcripts. It represses gene translation. It has role in neuronal plasticity, and also it regulates the function of group 1 metabotropic glutamate receptor 5. And this receptor basically is, if this FMRP protein it is lost, it is seen that there is a increase in the activity of this receptor, which subsequently leads to abnormality in the synaptic plasticity. So this FMRP, this protein is again associated with autism spectrum disorder. And in fact, in animal models, it is seen that of Fragile X syndrome, it is seen that glutamate receptor antagonist and lithium, they may show some improvement in some of the features of this autism spectrum disorder. So again, this seems that FMR protein, this plays an important role in ASD. Now, there are certain important genetic disorders which are strongly associated with autism spectrum disorder. Let's talk about two important genetic disorder. One is Fragile X syndrome. In fact, it is the most common inherited disorder associated with ASD. It is present in 2 to 3% of individuals with ASD. Another important disorder is tuberous sclerosis. Again, in up to 2% individuals with ASD, tuberous sclerosis may be seen. So these are two important genetic disorders associated with ASD. There are certain other disorders. We'll discuss a list of some of those disorders in the end. And let's briefly discuss these two disorders. So first is Fragile X syndrome. As the name suggests, it is basically a X-linked recessive disorder. And in this disorder, there is a triplet repeat of CGG, that is cytosine, guanine repeat in the regulatory domain of FMR1 gene. So there is FMR1 gene which is involved. It is at the 5' untranslated region. So this gene is involved and there is a triplet repeat of CGG. Now let's talk about certain findings, physical findings and behavioral findings which we see in Fragile X syndrome. And we can remember it with the mnemonic or with the name Fragile. Let's try to see some of these findings. So in Fragile X syndrome, F, you can remember, stands with faces. So there are characteristic faces, and you can also remember F is the FMR1 gene. R, again you can remember, R is retardation. There is mental retardation also seen. So we'll talk about this when we'll also discuss mental retardation, that is intellectual disability, that Fragile X syndrome is also related with mental retardation. Of course, autistic features can be seen, and also certain behavioral findings such as attention deficit, anxiety may also occur in these patients. G is gross and fine motor impairments which may also be seen. I is impulsivity. Again, impulsivity may also be seen in these cases. Then L is language ability. There is a decrease in the language ability, especially the expressive language. And E is enlarged testicles, also known as macroorchidism. So these are some important findings which are associated with Fragile X syndrome. Now it is seen that in Fragile X syndrome, 20 to 30% boys may meet the diagnostic criteria of autism spectrum condition. And when we look at the idiopathic autism, it is seen 1 to 8% of the boys may have this Fragile X mutation. So again, Fragile X syndrome is closely associated with ASD. Second is tuberous sclerosis. Tuberous sclerosis or TS, it is a autosomal dominant disorder in which there is abnormal tissue growth, or there are benign tumors or hematomas which are seen. And the rate of tuberous sclerosis in autism, again, is the range is 0.4 to 2.8%. So in fact, this is higher rate than in general population. So again, tuberous sclerosis is associated with ASD. Also, it is seen that in TS, there may also be intellectual disability and seizure disorders may occur. Now, let's talk about the genes. So there is mutations in the genes which encode for TSC1, that is TS complex 1 and TS complex 2. And these are members of the mTOR. mTOR basically is the mammalian target of rapamycin, and the AKT, that is protein kinase B, intracellular signaling pathways. And these pathways, they have important role in cell processes proliferation, in the growth, in the cell survival, and in the mobility. And when these genes are affected and these functions become abnormal, and subsequently they are also associated with autism spectrum disorder. So here is a list of some of the important genetic disorders which are associated with ASD. Again, one should remember some of the important ones such as Fragile X syndrome, tuberous sclerosis or TS. Then there is neurofibromatosis. Even in Rett syndrome, we'll talk about Rett syndrome. In fact, in DSM-4, it was one of the subtypes. And again, it is also associated. Then phenylketonuria. Then some of the other disorders, such as Williams syndrome, Prader-Willi syndrome, 22q11.2 deletion syndrome, that is Digeorge syndrome. Then DMD, that is Duchenne muscular dystrophy. And even with sex chromosome aneuploidies such as Turner syndrome or Klinefelter syndrome, there is also an increased risk of autistic features. So these are some of the important genetic disorders which are associated with autism spectrum disorder. Now, when we talk about the certain areas or loci, in the chromosomes which may be associated with autism spectrum disorder, in fact, Rutter mentions. So in Rutter, it is mentioned that the most common abnormalities, they involve the areas 7q and 15q. So this specifically, again, this data may be specifically asked as it is mentioned, so, specifically in Rutter, that the most common abnormality is on 7q and 15q. Again, CTP, mentions that the chromosome 2 and 7 regions may contribute to ASD, and additional areas such as 16 and 17, chromosome 16 and 17 may also be involved. So these are some of the areas which may be involved in autism spectrum disorder. Now let's talk about certain biomarkers in ASD. Again, genetic studies have highlighted some of these biological systems which again may act as a biomarkers in ASD, such as elevated platelet serotonin. Second is mTOR, that is mammalian target of rapamycin linked synaptic plasticity mechanism. Again, that is also been implicated, and alterations of the GABA inhibitory system. So these are some of the biomarkers which are seen in ASD. So let's talk about an important biomarker, that is elevated platelet serotonin. So it is seen that the platelet serotonin are elevated in autism spectrum disorder. Let's try to understand how this elevated platelet serotonin is again is relating with or is a biomarker for ASD. Now, platelets, they acquire serotonin through the SERT, which is a serotonin transporter, and which is heritable. And this occurs, when these platelets, they pass, through the intestinal circulation. Now, genes for SERT, that is the SLC6A4 gene, and gene for serotonin receptor, that is 5-HT2A, the gene is HTR2A. Now these genes basically they encode for protein in platelets as well as in the brain, and these genes are more heritable than in fact even ASD. Now it is seen, so that means serotonin is involved in brain development, and changes in the serotonin regulation may cause changes in the neuronal migration and the brain growth. And again, it is seen that elevated serotonin, platelet serotonin, is associated with autism spectrum disorder. So it is one of the biomarkers in ASD. So these were some of the important genetic factors which we've discussed in ASD. Now let's talk about the neuroimaging. Again, there are certain findings which we have seen especially in ASD related to the neuroimaging. Now, this observation, has been there for quite some time, that children with autism, they seem to have enlarged heads. So enlarged heads or significantly increase in the head circumference. This is one, finding which has been, seen or identified. Now, in MRI studies, it is seen that there is an increased size both in gray and white matter, and especially the white matter. In fact, there is a disproportionately increase in white matter as compared to the gray matter. And this disproportionate increase may also suggest that there is, highly, disconnected networks may be there. And the regions in which there is increased size involve especially the frontal and the temporal region, and also the amygdala. Amygdala again is associated with emotional processing, emotional memory. So these are some of the areas which are seen to have increase in size. Now, but these changes which occur, or this increased size is seen, may begin even before 1 year, but by the time the child reaches adolescent, it is seen that they may have similar sizes as compared to the other controls. So this is more in the initial stages of development. So macrocephaly may be seen in 15 to 20% of the cases with ASD by 5 years. Again, but certain studies, certain MRI studies have shown that there may not be a total increase of the total brain volume. And some studies have shown there may be increase in certain areas such as amygdala or striatum. Again, striatum increase may be associated with certain stereotypic movements. So there are certain areas in certain studies which have been shown to be increased. Now this atypical or this changing total brain volume may suggest that there is a sensitive period or a critical period in which brain plasticity, gets disrupted and subsequently leads to ASD, especially in the initial developmental phase. Now, there are studies with the name of IBIS, that is infant brain imaging studies. So some of these studies which are done on at-risk siblings of a youth with autism, and MRI is basically routinely done between 3 to 6 months of age and subsequently at regular intervals till 2 years of age. So there are certain interesting findings which we have found from this IBIS studies, and many of these studies they suggest that ASD may start at first year of age or even before that. So some of the interesting findings of the study include that there is a blunted development of axon fibers in ASD between 6 months to 2 years. Then white matter microstructural abnormalities may occur at 7 months in ASD, and fiber network insufficiencies may also occur. And in fact, it is seen that white matter may show aberrant organizational properties in the first year of life. So, the child is having a bigger brain but is less well connected as compared to the smaller brains of the controls. So the size is increased, but it seems that there is a lot of problems in the connectivity. So this may be one of the findings. Now, let's talk about some fMRI findings. Again, various types such as task-based or resting state of fMRIs have been done, and these help us in localizing specific functions related to social ability to specific areas of the brain. So certain functioning, certain social functionings, especially related to specific areas of the brain, have been highlighted or have been identified. Let's talk about some of these important findings. So one of the areas which is implicated is the fusiform gyrus. The fusiform gyrus area is basically related with facial recognition. So through visual images, again, when tests are done, it is seen that there is this area is hypoactive in autism spectrum disorder. Now, basically, when we see someone with autism spectrum disorder, it is seen that they scan the faces of other people differently, and in fact, they focus more on the mouth region than the other features of the face. So there is some problems in facial recognition, and one of the areas which is implicated is the fusiform gyrus. And in fact, this area is also connected with certain other regions such as the limbic system. Also, it is connected with the amygdala. Again, they are also, some of the areas which are implicated, in some of the features of ASD. So second is amygdala. Now, again, it is seen that amygdala is related with the emotional perception, with the emotional learning. And again, this may be also dysfunctional in autism spectrum disorder. Then certain areas such as the extended amygdala or the ventral striatum or the nucleus accumbens, which subsequently they form the social reward circuitry. Again, these areas are also affected, and in fact, it is seen, the fMRI studies have shown that these are hypoactive in ASD. Again, these areas, they have a role in directing attention to socially relevant things in the environment. For example, how to start or how to, continue a social communication. So these areas, play important role in the social communication or the social interaction, and it is seen that they are implicated or they are affected in autism spectrum disorder. Then certain other areas which are implicated include posterior superior temporal sulcus. Again, this area is important as certain important functions such as interpreting non-verbal communication, action observation, and also theory of mind again are related with this area. So theory of mind basically is the ability to attribute the emotional states to others and also to oneself. So this theory of mind basically means interpreting what others are thinking and what others are feeling. So again, these things are also affected in autism spectrum disorder when we talk about some of the important clinical features and diagnostic criteria. So it is seen that again theory of mind is also affected in ASD, and this is one of the important areas. Another area, that is the medial prefrontal cortex. In fact, this is one of the central area or the hub of theory of mind. Again, this is also affected, and also the orbital prefrontal cortex, which is again associated with emotional learning. Again, all these areas are affected, and this is again shown by the fMRI. So again, one should know some of these important areas associated with some of the important functions. Now, there is a growing consensus that there is dysfunction in the mirror neuron system, that is the MNS, in the patients with autism spectrum disorder. In fact, it is seen that when someone is performing, when we are doing, studying someone's brain, and different, activations in certain different regions of the brain may occur, and involving the theory of mind, it is seen actually the dysfunction is because of this mirror neuron system. So what is this mirror neuron system? So basically, when we perform some task, there are certain areas in our brain which are activated. Now this mirror neuron system, this basically represents certain neurons which get activated even when we see someone performing those tasks. So even if you're watching someone doing any activity, certain areas of the brain, they are activated, which get activated when we are doing those tasks. So this is a mirror neuron system. That means there is mirroring of action and behaviors of others. And it is seen that this system is affected in patients with autism spectrum disorder. And one important abnormality you can remember is, normally in the mirror neuron system, there is suppression of the mu waves. So you can remember one important point here, that normally when when mirror neuron system is activated normally in any person, there is a normal suppression of mu waves. But in ASD, it is seen that there is abnormality in this normal suppression of mu wave which occur. So again, please remember, this is an important growing evidence of involvement of mirror neuron system in autism spectrum disorder. So these were some important neuroimagings which are implicated in ASD.